we're joining in from. Thank you so much for joining us for this virtual event. We are here today to present a new book on the repercussions and policy lessons learned from COVID-19. Hard to believe, it's now been 2 years, more than 2 years, that we have been living with COVID-19. We're very keen to hear from you throughout this seminar, so please submit your questions. We'll get to the Q&A session after the final speaker. You can submit your questions on IFPRI.org, Facebook, LinkedIn, YouTube, or by using the hashtag AskIFPRI on Twitter. It's now my pleasure to turn over to Jo Swinnen. He is the Global Director of the Systems Transformation Science Group within CGIAR, as well as the Director General of IFPRI. Thanks for being with us this morning, Jo.
Thanks very much, Charlotte. Welcome, everybody. Today is 7 March, and it was 2 years and 1 week ago that I took, for the last time, a plane until quite recently. So that was on the last day of February in 2020. 10 days later, the IFPRI offices closed down, as did many offices around the world in response to the spreading pandemic. By the end of March already, we had our first webinar on the impact of COVID-19 on global food security. And early April, we had launched a blog series bringing together research, emerging insights, etc., going forward. And 5 months later, early August 2020, we published our first ebook. Looking back, actually, it's quite incredible that this was possible. I think it was only possible within an organization such as IFPRI and the associated research between whom we collaborate. It's the combination of great research insights, great research minds, strong capacity there, the network that we have, excellent support staff and communication for all the webinars that we organized and for the blogs, and then for the ebook, the first one and the second one. Now, of course, COVID-19 did not stop in August 2020. It is still here. Our research has also not stopped. We still continue to work on it, getting better data, better conceptual frameworks, better insights on the impact of the pandemic, and also more understanding of what's in the medium run, the impact. Today we are unfortunately in a crisis again, another type of crisis, but we believe, and as you will hear today, a lot of the work on COVID-19 is about resilience of our food systems. And this, of course, is relevant for the crisis we are unfortunately facing today again. We have a stellar lineup of speakers. I am not going to use more time. I'm really happy to pass the floor to John McDermott. John has shown great leadership over the past 2 years in our work here, both in supervising, guiding the work of so many researchers, but also in taking the leadership on the CGIAR COVID-19 hub, which he has really helped to establish and to lead throughout the past 2 years. And of course, as a lead editor of the second ebook. Over to you, John.
Thanks, Jo. So yes, let me go through a kind of overview of the book. Next slide. Why this book and why now? Well, a lot has changed in 2 years. The first book, as Jo described, we got some initial impacts and responses. Most of those were by the end of June 2020. But information was relatively scarce and we were piecing it together. And I think there was also a hope at that time that COVID-19 would be controlled and we would be moving on by now to recovery and building back better. But the experience is that COVID-19 has persisted and is very widespread. And the impacts have evolved as well. And these have in some ways exposed gaps and weaknesses that we had going into the pandemic. Some have exposed new gaps that we didn't understand, and some have shown new opportunities. And we wanted to take this opportunity of the book to provide evidence and lessons to help policymakers manage COVID-19 better in the longer term as it's persisting, and to combine that in a more systematic way with other challenges they're facing in terms of climate, conflict, etc. So next slide. So obviously the evolution of what happens on the impacts side for food depends a lot on what's happened with the virus. And as you can see, there's been a lot of deaths. And the official counts actually underestimate by quite a bit the deaths, particularly in Africa. The other feature of COVID is the waves of infection that have come through and made it difficult to manage in many places. And these are often associated with new variants. Now, the good news is that we have effective vaccines, and these have been developed and distributed in a kind of an unprecedented speed. And they protect against serious illness, which is a huge accomplishment. But that speed of vaccine distribution and delivery is not everywhere. And you can see that Africa is really lagging, both because of unequal distribution of vaccines, but also over time, we'll see that the weaker health systems there are slowing things down. Next slide. Now, food security and food systems impacts have also evolved. And especially in low and middle income countries, where initially human contact was really disrupted, it was especially a problem for poor and vulnerable communities. And of course, because of the disruptions of contact, urban populations were severely affected, and there was dramatic declines in incomes, which are being adapted for to greater and lesser extents in different places. But rural populations, even though they're less dense, are poorer, and they've also been badly affected. But the good news, I think, from a kind of food perspective is that food production and supply have been relatively well protected. But with time and with challenges, there's growing concerns for production and supply and increasing prices, which you'll hear about. Next slide. Now, these are challenging times for policymakers, and they really need to raise their game. And they're dealing with complex trade-offs that cut across sectors. There's no doubt that public programs are needed and have been useful, but the success depends on trust and public capacity and building on existing programs which don't exist everywhere. And they need to, as we've said, move on from focusing on COVID-19 to a more systematic approach that deals with other challenges as well. Next slide. So in terms of this ebook, it contains contributions from both IFPRI and its ongoing analysis and the blog series, and from the CGR COVID-19 Hub. And we've organized the book in 4 main sections: food security and poverty, ag production and value chains, nutrition, health and social protection, and policy responses and implications. And in each of these sections, there's kind of 2 contributions. Some are more synthesis of lessons we've learned over 2 years, and other ones are new or updated blogs from the IFPRI blog series that show key points. Next slide. Now, I'm going to present the section on policy responses and implications, and some highlights in this section. We provide a nice example of how the CGR COVID-19 Hub supported country demands in different countries for their priorities. We also provide examples of improving policy implementation, looking at how to build trust in science and government, and looking for how to make programs more effective in rural areas. We have a synthesis section on fiscal and monetary policies to support public responses, and on policy proposals for policy areas of emphasis for smarter food policies. Next slide. Now, in terms of the fiscal and monetary responses, in most low and middle income countries, fiscal responses have predominated. And the supports to households and businesses have been very useful in the short term. But there's no question that there's no clear pattern of how countries have responded fiscally and how that's led to different health and economic outcomes. There's just so many other factors in play. In the longer term, it's clear that the fiscal space in low and middle income countries is very limited. And so in the contribution, we look at debt relief, we look at increased investments from multilateral development banks, and even the potential for new financial instruments like pandemic bonds. And of course, all of this needs to be backed up by better ability to implement policies and policy actions. Next slide. Now, the lead contribution in this section really looks at 4 areas or 4 policy domains where we give suggestions about how policymakers can have smarter policies. And 2 of these consider what I would say are kind of ongoing policy gaps and challenges, and 2 of them consider evolving policy opportunities. And the first one highlights the need for better cross-sectoral coordination, which is very difficult for policymakers. But I'd like to emphasize from the outset that it's not possible or desirable to coordinate everything. We need to do this much better, though. And one example that we highlight is obviously pandemic preparedness and response, where we need coordination across health, food, environment, and how these infections are very integrated into food systems and how food systems are managed. Now, there's been ample evidence of the economic costs of pandemics as well, and good plans for how to deal with them, but we've never implemented them in a systematic way. And the responses we've seen in the pandemic have often caused unintended harm, either to poor people or to small businesses, as you're going to hear later. So that's the first kind of area is on coordination. Next slide. The other one is, I think we have consistently shown that the pandemic's exposed gaps in our support to poor and vulnerable populations. And in many ways, responses have exacerbated inequalities. They've been gender blind, et cetera. And we need to be much more comprehensive and systematic about improving our support to poor and vulnerable populations. Now, I think there's 2 pieces of good news in this kind of overall support. And that is, we have shown that social protection programs can work, but it really needs to be much more comprehensive. And Nihal will discuss this more. Next slide. Now, in terms of opportunities, I think we have an opportunity by embracing food systems approaches to be much more systematic. And the 2 pieces of good news in that are, one, that really food systems approaches have been embraced at kind of global, regional, and national levels over the past 2 years, particularly in the UN Food System Summit. And we can capitalize on the country-owned and led plans for food system pathways and how to invest in their food system transformations. I think the other piece of good news is that there's been a lot of private sector innovation. It's been really impressive, now mostly by larger and more capable firms. And so that's going to be a challenge in low and middle income countries where most food is delivered by small and medium enterprises. But there's been great digital innovations, and there's been smarter bundling of technology with institutional changes and other tweaks, which are very important and which we provide a lot of examples. Now, finally, smarter policies in the last slide will depend on better information. We provide an example showing how the CGR and multiple partners have responded to demands from the government of Bangladesh to help them monitor and assess their food systems responses in a more timely and spatially explicit manner. And we emphasize the importance of really supporting national data agencies and policy analysts to embrace food systems approaches and objectives to expand their skills there, both in the traditional outcome areas of food systems, health, sustainability, and inclusion, but also adding resilience and efficiency to those considerations. And we've elaborated that much more in IFPRI's 2021 Global Food Policy Response. So Charlotte, over to you.
Thank you so much, John. Let me echo Yo's remarks. John has been the mastermind of this book, of the COVID-19 Hub, and really the last few years of his within the CGR system have been really devoted to getting information out about COVID. So I'd like to also thank you for your tremendous work on this. Thank you for highlighting some of the key findings on the policy side. We're now moving into a set of rapid fire presentations, which will look at the other sections in this book, in particular nutrition, health, and social programs, agricultural production and value chains, and food security and poverty. Our first rapid fire comes from Neha Kumar. She's a senior research fellow at IFPRI. And Neha will talk to us today about some of the findings on the nutrition, health, social protection program side. Over to you, Neha. Thank you.
Thanks, Charlotte. So this section of the book presents new evidence on how people around the world are doing in terms of access to food, nutritious food, health and nutrition services, school closures, and the role social protection programs have played. These studies help us in identifying the most vulnerable populations, the long-lasting effect the pandemic can have, and how social programs can be adapted for better coverage and more meaningful benefits. COVID-19's impact on nutrition cannot be emphasized enough. The economic crisis led to income losses, which in turn led to poor diets. We present here some projections using a moderate scenario, and which finds that it can lead to increase of 9.3 million children wasted, which is children who are thin for their height, an increase of 2.6 million children stunted who are thin for their age, 168,000 child deaths. It's also predicted that 2.1 million women will be suffering from anemia. And all of this will lead to $29 billion in future productivity losses, mostly concentrated in South Asia and Sub-Saharan Africa. And this is triggered not only by supply side factors owing to lockdowns and services being diverted to COVID, but also demand side factors such as households being reluctant to use these services from the fear of getting infection. Next slide, please. School closures across the world will affect more than just schooling outcomes. So even as lockdowns were lifted, schools remain closed, and that coupled with unequal access to remote learning options, it will lead to wider gaps in learning. It will lead to long-term impacts on lifetime earnings, dropouts among the most vulnerable, also, poorer households and girls are more likely to drop out, and there is potential exposure to domestic violence. School closures have also impacted food security due to disruptions in school feeding programs, and these impacts are too uneven. So where poorer households and single mothers are more likely to be affected by this. Next slide, please. Social protection programs, as John mentioned, have been instrumental in COVID relief response. These programs have been leveraged to provide and continue support. However, it has not always been smooth. So for example, while it was possible to expedite payments, it was not as straightforward to increase entitlements or coverage. There is no doubt that increasing payment amounts is better for the most vulnerable, and good for us that evidence supports that. So increasing transfer amounts can trigger greater GDP growth. And in countries such as Ethiopia, where national safety net programs have been operating over a decade, where systems are in place, we find that transfers virtually offset all of the adverse effects of the pandemic on these households. Next slide, please. But social safety nets target the poorest, and in crises such as these, even the non-poor can fall into poverty. So we need to design programs that are flexible, with the ability to increase coverage and entitlements. Safeguarding and promoting access to nutritious food is also key, which can be done by making social protection programs more nutrition sensitive. And last but not the least, we must invest in maternal and child nutrition outcomes. They are important in their own right, but they also have long-term implications. Thank you.
Thank you so much, Nia. Those are staggering estimates that you put up, and you highlighted the role of social protection, but also the need to do social protection better in the future. And I think the key takeaway from your presentation is the potentially very long-term implications of COVID-19 that will be with us for years to come. Our next rapid fire comes from Professor Tom Reardon. He's the University Distinguished Professor at Michigan State University, and as of recently, also a non-resident Senior Research Fellow at IFPRI. Tom, you're going to speak to us today about the stresses caused by COVID-19 within value chains, but also about some of the innovations that we've seen in the value chains. Over to you.
Thank you very much. Let's set the context. Before COVID, for decades, food supply chains have been buffeted by recurring crises in developing countries. They've been harassed and constrained by high transaction costs and high risks, by climate shocks, by conflicts, by crop, animal, and human diseases. And yet, what we've seen over those decades is that over and over again, the food supply chains bounce back. And this is what we saw during COVID. Before COVID, for 3 decades, food supply chains grew rapidly, dynamically. In Africa, 800%. In Asia, 1,000%. Before COVID, food supply chains grew to feed 80% of all of the consumption of food in developing countries, which is also the share of purchases in total consumption, with the remaining 20% being subsistence. So we had dynamic growth and success of food supply chains writ large in developing countries. Before COVID, for decades, millions of small enterprises made massive private investments. Large enterprises made massive private investments. Governments themselves grandly invested in wholesale markets and in roads. So this was the stage that was set before COVID. Then in early 2020, COVID struck. Food supply chains were battered once again. To limit disease spread, governments instituted lockdowns. To save money because they lost jobs or they wanted to hunker down, consumers reduced food demand. To expose themselves less to the disease, many workers went home and stayed home. So this is the battering that the food supply chains took in that first half of 2020. As a result of that battering, downstream firms, for example, restaurants and retail, were deprived of in-person customers. Midstream firms like wholesale and processing and logistics were constrained in their movement. They were deprived of labor. They were deprived of inputs. Upstream firms like farms and input dealers were deprived of imported inputs and of labor. This is a real battering. And with that, there was a seesaw of prices that firms faced and consumers faced. With the cost surges, prices surged. With the demand constraints, prices fell. So there was a seesaw in prices. Now, just like before COVID, in the second half of the 2020 year and into 2021, we saw that food supply chains largely bounced back. I say largely because it wasn't complete, the success. The blood of the food supply chain started to flow again. The blood is the third-party logistics, the truckers, the wholesalers. This is what makes the system move. That's the center of the whole system. And then labor started to flow again, raising workers' incomes, and of course their food demand. Imported inputs started to flow again. Consumers re-emerged from their houses and started to go to restaurants and retail shops. So you had a rebirth of the food supply chains right after the COVID shock. And what really fascinated us in our research, and Yo pointed this out at the beginning, is that food supply chains were largely resilient to this shock. They largely weathered the shock. We explored how they survived. We looked at the resilience strategies they used. Some small firms simply hunkered down during the lockdowns. They reduced activity. They waited it out. But many firms adjusted and pivoted to the new rules. They started, for example, going to wholesale markets earlier or later in the day to get around restrictions. Many firms diversified their sourcing, okay, or substituted to new inputs into local labor. Often their ability to do that substitution were muscles built up by being shocked over several decades before. Really interesting case of South African citrus, for example. And very interesting is that many enterprises, not just large, but also small, digitalized their businesses. They shifted, they pivoted into e-commerce and delivery. There was a surge of delivery intermediaries, for example, Swiggy in India that serviced 40,000 small restaurants during this time to deliver food. But not all of this was success. Not all of this escaped challenge. Many small enterprises were resilient. Okay, so it's not a picture of the small dropped out and the big won. Many small enterprises were resilient, but not all. Some that had too little savings, too few assets, or too little flexibility to pivot either went out of business or struggled to recover and finally recovered. Also, food supply chains overall bounced back, okay, but so did prices, especially international prices and in the products that are imported like grains. As demand bounced back also, there was a strain, especially on international commerce of shipping and ports and container supplies to be able to supply this renewed system and that had a backlog of demand. And of course, as we know, it's not over. COVID shock came and now here comes the battering again. Climate shocks, international conflict. So again, the resilience strategies and the muscles built up during COVID and before need to be reflexed. Build back better, to us, I think, in the message of the book is invest in the fundamentals, the roads, the wholesale markets, the ability to be resilient, and invest in good policy that's flexible and allows risks to be reduced and transaction costs to be reduced. So the millions of small entrepreneurs and large entrepreneurs in developing countries can again exercise their resilience muscles. Thank you very much.
Thank you very much, Tom, for so vividly painting a picture of value chains throughout the COVID period and indicating that the muscles that have been built up are going to be sorely needed, also moving into the future. Our last rapid fire comes from James Thurlow, who's a senior research fellow at IFPRI, and James will discuss the impacts of COVID-19 on food systems, poverty, and diets.
Thanks, Charlotte. So I think if we cast our minds back to the early 2020, to the beginning of the pandemic, you'll remember it was a time when we were suddenly inundated by models, by epidemiological models telling us that we needed to bend the curve and the social distancing policies that were needed to achieve that. At the same time, back in early 2020, IFPRI's own modelers mobilized and use their global and national models to try and estimate what we thought the impacts of COVID-19 might be on national economies, on food systems, on poverty and diets, and so on. And this was very much in demand. At that time, history wasn't a very good guide for us. This was an unprecedented moment, an unprecedented shock. And so we needed our models to help us piece through what or estimate what we thought the immediate and long-term impacts of COVID might be and how that might shift our policy priorities over time. And so at IFPRI, we worked together with local researchers and government officials to piece together, sector by sector, policy by policy, what we thought the economy-wide impacts of COVID might be. And so I think now that we're 2 years down the road, and I think it's an opportune moment. The book is very opportune to give us a chance to stop and reflect on what it is that we got wrong and what it is we got right. Next slide, please. So in our chapter, my co-author and I, Carl Poe, we list a very detailed set of reflections on what we got wrong, and I'm just going to focus in on one. And I think the biggest thing that we got wrong was that the impacts that we were initially estimating back in early 2020, how bad was COVID going to be for the economy? Our initial estimates were perhaps larger than actually turned out to be the case in many countries, right? You can see on the left-hand side here for the 3 countries we're focusing on today, the impacts of COVID that our simulated impacts, a decline in GDP relative to the baseline, our simulated impacts in blue were substantially larger than what actually turned out to be reported in official statistics looking back from 2020 back at in 2021, looking back at 2020. And so the question is why? Why did we get this wrong? Why were we so pessimistic? And I think we've covered some of the reasons Tom and Neha have mentioned, and John. The first, as Tom mentioned very clearly, is that people and firms tended to adapt much better than we originally thought. Our models were built on supply chains as they were configured leading into COVID, and they adjusted quite well during the pandemic, although it took time. The stories of trucks lined up outside of cities unable to get in, those stories were headlines in the early days, but they declined over time and became less frequent. As Neha said, governments introduced very important mitigating policies. Almost every country in the world introduced a social protection program, and most countries also provided working capital. It didn't always reach the informal or the small firms, as Tom has talked about, but governments were generally quite quick and had quite large-scale programs where they could afford it. Another area, and this is not to pass the buck, but in our modeling, we were drawing on analysis and projections from others. And it turned out that those global shocks that places like the World Bank, the OECD, and elsewhere were predicting, particularly in terms of foreign direct investment collapses and declines in remittances, those early projections turned out to also be more severe than actually turned out to be the case. So, for example, 20% declines in remittances and FDI were projected for developing countries. It was half that in Africa. And in fact, FDI and remittances increased in Asia. So that's part of the reason why collectively we got things wrong. So I think if there are two lessons we're going to draw from this, the first is somewhat self-serving, and that is we definitely need to invest in our foresight tools and data and in the partnerships in country so that our partners who can use these tools with us to evaluate impacts of things like COVID and climate and all the other shocks that Tom has talked about. But I think we also need to be honest and say that while there was a lot of attention given to these models early on, they are not perfect foresight tools. They're just opportunities for experimenting and learning. Next slide, please. What did we get right? And I think the big thing here, and Tom has talked about it a lot, is that the agri-food systems, and agriculture in particular, turned out to be a very important safety net. Our modeling showed that agri-food systems, while negatively affected, were far more resilient than other parts of the economy. And as a result, rural households and also poor households were less exposed to their shocks than, say, their urban counterparts and so on. And so I think to some extent, while we need to draw attention to those big numbers that Neha mentioned in her rapid fire presentation, we also need to talk up the importance of agriculture as a safety net, how it became a refuge for many of the displaced and the unemployed during COVID. That said, there's still a lot of uncertainty about the longer term implications. On the bottom right-hand side, you can see some of our projections for poverty. And you can see that we are still quite pessimistic. It's going to take time for us to recoup some of the years of growth that we have lost. I think the clear message is, as Tom has said and John has said, we need to continue to invest in agriculture, not just in the short-term social protection programs, but in agriculture as a national safety net. Thank you very much.
Thank you so much, James. Some very important takeaways from you. Before we move to our three discussants, let me remind all of you that we're coming soon to the Q&A session. So please do submit your brief questions on ifpri.org, Facebook, LinkedIn, YouTube, or by using the hashtag AskIFPRI on Twitter. Our first discussant is Sudha Narayanan. She is also a research fellow at IFPRI. And Sudha, thank you for being with us today. You're going to address, not an easy task for all of on a global, for South Asia, the impacts of the epidemic in that region.
Yeah, thank you very much, Charlotte. I'd like to begin by congratulating the team that's put together this beautifully produced volume. I think it's timely, necessary and valuable to revisit where countries are with the COVID-19 fallout. I want to bring together 5 points, 5 issues that seem to stand out from a South Asia perspective. And I think some of them reinforce what other speakers have said before me. Others sort of are qualifiers. And I want to point out that the perspective I take is that our research agenda around COVID impacts is still unfinished, and we need to pursue these further in the next couple of years. So the first point I want to make is that these challenges are continuing. I want to draw on our research in Bangladesh's agri-food supply chains. We looked at fish and shrimp, and we found strangely that although most studies had suggested a strong recovery and resilience 6 months after the crisis, our surveys 1 year after the crisis suggest that a lot of midstream actors actually closed at that time, suggesting that there's some kind of sleeper effect. Yes, people are able to hunker down and hold their breath, but how long can they do it? So this kind of sleeper effect is something that we need to continue to track and see how the churning in the midstream actors happens. The second is the demand recovery. I think if you go commodity-wise, some commodities have seen a stronger recovery and other food commodities have not seen such a strong recovery. And in fact, ongoing research work from India's peri-urban areas, farmers are suggesting that this year prices for horticulture crops have just not increased, and they attribute it to a decline in demand. And so this continuing challenges is something that we need to keep on the radar. And it's linked to my second point, which is on the macroeconomic dilemmas. So countries seem to wait, the South Asian countries in particular, they know they need to spend to stimulate demand. And that would in turn improve the investment climate. But at the same time, because the economy has taken a hit, there are very few sources of revenue. So I want to bring the example of India here, where this idea that should we wait, how do we stimulate consumption and provide a good investment climate? It's chosen to rely on fuel taxes, which in turn increases the costs and has led to inflation today, well after a year after the crisis. So there are some unintended consequences of trying to getting the macro policy right that I think is useful to keep in mind. My third point is on policy misadventures. I think many countries in South Asia try to use COVID as a crisis to fix the structural problems, regulation and so on. So a striking example is of Sri Lanka, which kind of banned imported chemical fertilizers and pesticides and forced 2 million farmers to convert to organic, which backfired. And in the Indian case, it's farm laws, which were not, this was not particularly an opportune time to introduce very serious structural reform. And so I would classify these as policy misadventures when governments should have in fact been focusing on something more fundamental and humanitarian. My fourth point is on missed opportunities. I think Neha pointed out, we all thought when COVID hits, all the South Asian countries would have this new awakening to the dismal state of health infrastructure. And strangely, that's not happened. I think the current focus is largely on recovery and investment, ease of doing business. But I don't think there's as much conversation on the investments that need to go into health infrastructure in particular. And the fourth point I have to make is on the political economy of policy making. Even the COVID response, I think a lot of the questions we had was who's making these policies, who's being consulted. And it's not very clear that it's the right experts were giving in inputs to in terms of COVID policy response. I myself have participated in government consultations. I like to think I'm the right person to be consulted, but there was also a disproportionate share of large businesses representing agribusiness interests and so on. And related to that is this idea that who benefits from these policies? And in my own view, both in Bangladesh and India, we've seen that large agribusinesses fared much better, but not because they were more efficient, but because they had a year of the government and could get privileges that others were unable to do so. So that would be the political economy of policy making, and we need to understand those processes much better. And my last point is looking at the responsibility of researchers. Reviewing all the work that's come out of South Asia, it's not very balanced at all. In fact, we know very little about Pakistan, for instance, and thematic themes. I've already discussed the understudied themes, but it also seems to translate into how some regions have a lot of research coming out and others very little. And I think we need to focus a little more on, as researchers, to cover these research gaps. So I will end with that, and thank you for the opportunity for this conversation. Thank you.
Thank you very much, Sudha. You raise a number of really important points that I'm sure are going to be taken up in our Q&A session. Next, we move to Africa. I'm delighted that Jemima Njuki is with us today. She is, as of I think just last week, the chief of the Women's Economic Empowerment at UN Women. And prior to that, of course, she was IFPRI's Africa director. Thank you very much for joining us, Jemima. You also have a difficult task. What are some of the key impacts and developments for that small region of Africa?
I know. Thank you very much, Charlotte. I'm so excited to join you this morning. I think let me just start by focusing on a couple of points about some of the differential impacts that we saw of the pandemic in Africa, and what are some of the evolving issues that I think we can learn from this book. One is we saw sort of lower health impacts from COVID-19 in Africa. Deaths have been much lower than in other parts of the world. The current tracker we have now, that I think the last update was in December of 2021, showing just about 150,000 deaths and about 6 million cases. So much lower impacts than we've seen in other parts of the world. But even with that lower numbers, what we've actually seen is a huge impact on the health system. And I think moving forward, that's going to be a challenge for the continent in terms of rebuilding some of the other health programs that have actually either fallen off the radar or slowed down as a result of the response to COVID-19. So we've seen challenges, for example, that have, and I think that are going to have some long-term impact in terms of disruptions in things like child immunizations, disruptions in our HIV programs, malaria and TB programs, just because of health systems being really overwhelmed. But what we also saw was some unexpectedly quick responses from governments in terms of even continental organizing around the Africa CDC, use of digital tools. We had countries like Rwanda, countries like Ghana really deploying digital tools to make sure that drugs, testing kits that actually reached rural areas and other populations that were hard to reach. But the biggest impacts actually were around the economic impacts, disruptions in trade, drops in global demand for some of the resource products that come out of Africa, whether those are agriculture products, horticulture products, and other natural resource products from the region. But one other big impact was actually disruptions on some sectors that play such important roles in countries' economies and GDPs, like tourism. So we saw huge drops in tourism in countries that depend on tourism. We saw huge drops in remittances, just because there were disruptions in employment for and especially for countries where there's a lot of dependency on remittances, countries like Somalia and others. But this then had some impacts on poverty, on food security. We saw school closures, and so even though the health impacts weren't as huge in terms of numbers, we did see a repercussion of these impacts in other ways, both on the health system but also on the economy. So to maybe three things that I think are going to be really important moving forward. One is some of the economic responses around either economic stimulus or social protection. We saw an expansion in that. And I think the big question that remains, and that's also an issue for both research and cooperation, is to see how much of these economic stimulus packages and expanded social protection is going to remain moving forward, because the impacts on job losses, the impacts on food insecurity, those are going to be felt for much longer than just this short-term recovery period. I think it was James that mentioned the role of agriculture as a social safety net, and what we started experiencing, at least from an anecdotal perspective, is what people were calling reverse migration, where before migration was from rural areas to urban areas, and we started hearing of reverse migration flows. And I think for research, from a research perspective, that will be an interesting phenomena to track and see the extent to which that was at a scale that has an impact on agriculture, or the extent to which that was temporary, and now we're going to start seeing migration back into urban areas. And the third thing that I think is really critical for research is we saw more impact in the informal sector, informal wage workers, women who are working in the informal economy, and the extent to which the recovery, that sector is recovering. I'm not sure there's enough research, or the extent to which there are actually long-term strategies to ensure recovery of the informal sector. So hoping to see this, sort of more research going into that. Back to you, Charlotte.
Thank you so much, Jemima. We're now moving to Latin America and the Caribbean. Valeria Pinheiro, a senior research coordinator at IFPRI, is going to discuss some of the impacts and developments in that part of the world. Over to you, Valeria. Thanks so much for joining us.
Thank you, Charlotte, very much for introduction. And I would like to just start congratulating the whole team for putting together this book in such a short timing and not timely wise. So today I'm just going to concentrate in Latin America and the Caribbean. And I would like to start first with the impact of actually COVID-19 that happened in the region, and really give some direction of why we think that it was hit so hard at the very beginning of the pandemic. So the region is home of 8% of the global population, but about like 30% of all COVID-19 deaths came from this region. So some of the characteristics that may explain why it has been particularly vulnerable to the pandemic is that 80% of the population live in urban areas. Roughly half of employment is in informal activities. The rates of overweight and obesity are among the highest as well in the world. And last, the health system has suffered because of the region's economic stagnations in the previous decade. So the governments have reacted very differently in diverse policies as well, depending on the country. So we went from strong lockdowns in countries such as in Argentina, Chile, and Peru, to just live really uninterrupted in Brazil and Mexico. Also, the stimulus packages were very different. In Brazil, Peru, and Chile, they spent around 5% of GDP through fiscal measures, but Mexico and Uruguay only spent like 1% of their GDP. In 2021, the region experienced higher than expected growth, actually averaged 6%, due to the low baseline, first of all, that was coming up from 2020, but also to greater mobility, and that is the graph that it shows in this slide, as well as medical advances in controlling the virus, the fiscal and monetary expansion, and to also a favorable external context as well. So it's not only from the region, from the outside as well. However, obviously, tourism and services are still down. So regions like the Caribbean and Central America are still very strongly affected by this. Post-pandemic, the region will need to expand support for long-term transformation from the Latin American countries, the food systems, and redesign safety nets to address both the lingering impacts of the crisis, but also some of the vulnerabilities that really underlie these impacts.
However, we're not there yet. COVID-19 has magnified some structural gaps in inequality, limited fiscal space, that it was also mentioned previously by all the other speakers, low productivity, informality, and fragmented social protections and health systems. Moreover, the pandemic has led to almost 11% increase in unemployment, 54% increase in informal labor, and the closure of almost 3 million small and medium enterprises. Of course, that in 2022, this number had been decreasing, so it's getting better. But as I've seen, these kind of impacts will affect in the long term as well. So next slide, please. We have been hearing, I will move a little bit, but trade will affect Latin America in particular as well. So we've been hearing for the last 2 years that COVID-19 has underlined the importance of the robust, efficient, and resilient agri-food system to feed the world with a nutritious and diverse diet. And actually, Vernon already mentioned this earlier today. So here is one of the conclusions from actually the first book of this series that still applies. Trade matters. By moving food from surpluses to deficit regions and countries, trade can address production shortfalls, stabilize markets, reduce prices to consumers, increase the diversity of available foods, and influence also the preferences and diets. So as expected, the crisis has triggered a wave of inflation, and that's the graph in this slide. And again, the use of export restrictions have been implemented lately in the last couple of weeks to cut local inflation reality, like in Argentina and Indonesia. It's important to note one of the findings that actually come from the book, that income loss and supply disruptions have also affected dietary choices, increasing global malnutrition. Low income and lower middle income households have switched from cheaper and less nutritious foods and reduced their consumption of the perishable foods, such as fruits and vegetables. In turn, also these shifts have limited the dietary diversity and increased the risk of negative health consequences, as it was mentioned. In a study that we did with Eugenio Diaz-Bonilla and David Laborde for Latin America, we found that the pandemic during 2020 was estimated to increase the number of people not affording a healthy diet by almost 37 million people, reaching more than 144. With the economic recovery, the number of people unable to afford the healthy diet declined, but still in 2022, there are still 7 million people more than in 2019 that cannot afford the healthy diet. Next slide. Unfortunately, today, we have to worry and plan not only for dealing with the remaining of the COVID effects, but also crisis and climate change. So, for example, for the last days, we have been following the ongoing Ukraine what's going on in Ukraine right now. I'm just going to mention just one little thing about food security lens. So if increases this conflict, it's increasing the oil and wheat prices, but the impact is definitely greater than that. So as just an illustration, I put this slide that shows the share of Russian and Belarus fertilizers in the world market. And it's just to give you a flavor that this will affect also production in many other countries as well. And with this, what I just wanted to conclude is that, or to say is that we do have to have a proactive, and this kind of publication helps in putting together the mitigation and adaptation strategies that we need to be able to face current and upcoming challenges. Thank you very much.
Thanks so much, Valeria, also for linking us to the new crisis that is before all of us now. Before we move to the last speaker, let me remind all of you again, please do submit your questions. We've got lots coming in already, but we want to hear from all of you. You can do that on IFPRI.org, Facebook, LinkedIn, YouTube, or by using the hashtag AskIFPRI on Twitter. So last but not least, we're really pleased that Chris Hilbrunner can be with us today. He's the Division Chief of Analysis and Learning Office of Policy Analysis and Engagement Bureau for Resilience and Food Security at USAID. Chris, thanks for being with us. The question that you're going to be speaking to is how have some of the key findings from the research, some of which we've heard today, about the fallout from this pandemic in low and middle income countries help to shape USAID's thinking on your own policies? You may be on mute, Chris.
Can you hear me, Charlotte?
Very well, yeah.
Great, thank you. So thanks to my fellow presenters, very happy to be here. And as some of my colleagues have also done, I'd like to start with a really heartfelt kudos to the many IFPRI researchers who've contributed to the book. I think the breadth and the depth of the work that's reflected here is really impressive and has really helped to influence the way we think about the pandemic and its impacts. So over the next few minutes, I'd like to touch on two sets of reflections. First, I'd like to highlight some of the insights from the research reflected in this book that have shaped our understanding of COVID-19 and the ways in particular that it's affected household well-being. And then second, I'd like to build off some of the discussion here to pose two broad questions for moving forward. So to begin, here are 5 key findings that I think have really resonated and shaped discussions within the Bureau for Resilience in Food Security. And again, I think many of these emphasize some of the points that have been touched on earlier. So the first is that the impacts of the pandemic on poverty, hunger, and malnutrition have been large and are likely to persist. These impacts aren't a bump in the road, but something we're going to have to be managing over an extended period of time, especially in developing countries and amongst more marginalized populations. I'd also highlight, and this has been mentioned earlier, is that these impacts, beyond increases in extreme poverty or increases in access to an adequate quantity of food, also include important declines in the quality of household diets. And this is an issue that we believe continues to receive inadequate attention. The second key finding is that impacts could have been worse, and that one of the things that really helped to mitigate some of our earliest concerns was the sharing of information. So things like IFPRI's export restriction tracker and efforts to really connect that information and analysis to decision makers helped to drive better policy and better outcomes for people. And so really keeping in mind that information sharing and decision support function and the positive outcomes that it helped to underpin. Third, that despite what was often, particularly in the initial phases of the pandemic, a heavy focus on urban areas, the way much of the research from IFPRI helped us to understand the important impacts that were happening in rural areas, including the idea that on average, the largest increases in extreme poverty were in these parts of the countries we were interested in. And then finally, that despite initial concerns about steep production declines and widespread failure of agribusinesses, that the global food system largely worked in providing food to populations. And the range of efforts that are reflected in this book, including the country and global modeling efforts, the research on innovations in supply chains, and the country case studies have all helped to illuminate the impressive resilience of food systems in the face of the pandemic. Obviously, despite these many insights, I think as one of my colleagues mentioned earlier, there's still many questions that remain. And there's two in particular that I know we're grappling with that I'd like to put to this panel and to this audience. One is returning to the discussion of policy responses that John covered earlier. I'd be interested in more of a discussion of what more we should be doing to mitigate the significant impacts of the pandemic on household well-being. We know that in the absence of further action, these impacts are likely to persist. In this book, Laborde, Martin, and Voss estimate that even in 2030, there will be 95 million more extremely poor people than in the absence of the pandemic. So while safety nets and other social protection efforts have been critical, What else needs to be done to mitigate these impacts, especially given the very real fiscal constraints faced by national governments and donors? And then second, building on the speaker who came right before me, while food systems have demonstrated a remarkable resilience in the face of the pandemic, other shocks loom large. So in a context of already elevated global food prices, the ongoing Russian invasion of Ukraine is expected to have a significant impact on both global food trade and agricultural input supply. So how concerned should we be about the weight of these issues on a food system that's already under stress? And how much can we rely on the resilience that we've seen in the food system over recent years to continue? So again, thank you very much for the opportunity to join this discussion, and let me hand the virtual microphone back to Charlotte.
Thank you very much, Chris. Those are two very good questions, and we'll cover them in our Q&A session, which we're now moving into. Let's kick off with sort of a question on the health implications here. So, and also a trajectory looking forward. John, you highlighted some of the really devastating impacts in terms of deaths around the world. You also pointed to the lagging vaccination rates in some parts of the world. Could you give us your best sense of where we're headed? I mean, some parts of the world seem to be thinking we're already in a post-COVID world, but that is certainly not yet, I think, concluded, and certainly not for some regions in the world. So let's just hear from you about what you think is the future of COVID-19 and how we'll see that playing out.
Yeah, thanks. It's hard to be authoritative about what the future of this is going to look like. There's going to be more twists and turns. So I think that I would just start off by saying that's the case. One thing that strikes me is that, and it goes back to this coordination issue and the cross-sectoral thing, is that we really have to be smarter, especially in the low and middle income countries who are facing all kinds of challenges of what the trade-offs are between what we do on the health side to control things and what we do in other sectors in terms of limiting human interaction, in terms of social protection and all those things. So I think a key issue is these trade-offs and how to kind of manage things across sector. And as I pointed out before, we can't manage it all, but let's look at the context in the countries and even subnational levels and the communities we're working with to get that right. Jemima's right in a sense that the health impacts in Africa were much less than we expected. And in a lot of countries, it's not their biggest issue. And so they're dealing with all kinds of other things. And so we have to remember that. On the other hand, I think there's a lot more of a health impact than is probably reported in Africa. If you look at the kind of unexplained deaths that occurred in Africa, there's probably something like 4 or 5 times underreporting of official COVID deaths in Africa. So there's a bit of an information gap there too. But and obviously vaccination offers an opportunity, but that goes with kind of weak health systems. So I guess one of my pleas on the health side is that there's a lot of context involved, and we really need to empower country decision makers, but also the people that work with communities. I mean, if we've learned anything in epidemic diseases over the years, and especially from HIV and things like that, is a lot of the issues are social. A lot of the issues are behavioral. And so you can't just come in with regulations that come out in a certain way, and there'll be all kinds of unintended harms that people won't think about. So we need a lot of flexibility in this. And I think Neha kind of pointed to that as well. So those are just a few reflections, Charlotte.
Great, thanks, John. Sudha, let me come to you next. You had a nice term, policy misadventures, and you spoke about the ban on mineral fertilizers in Sri Lanka, and also some of the attempts to rewrite some of the farm laws in India. Maybe, don't go into too much detail, but do you think it was just a question of poor timing, or do you think that those were just got off to a wrong start, regardless of COVID? What's the link to COVID in your description of these two policy misadventures?
sorry, I think my perspective, and I could be wrong here, but it's just that COVID meant that the usual democratic discussions and consultations, they were all focused on the epidemic itself and the management of that epidemic. And the fact that there were movement restrictions meant in a democracy, protests are less likely to happen, gatherings can be prevented, and so on. So in a way, I think that was one part of what was driving countries to push through some reforms. And they felt that there wouldn't be much of a pushback. But I think it also speaks to this larger change in the way governments are making policy, which is less consultative, more top-down, and so on. That's certainly true of India. I know less about the policy-making processes. So were these bad ideas? Possibly, but you're not given a chance to express that through consultations. And so maybe they were bad anyway to start with, but the fact that it's implemented in COVID means there's that much less discussion, consultation. So I think it's more of a processual issue than actually what it intended to do. And I think the process is what did not happen, and it should have happened, which would then tell us whether it was a good policy to implement or bad. So it was a misadventure because it chose this as an opportune moment to push something that in other circumstances or normal circumstances may never have seen the light of day.
Okay, very interesting. Thank you, Sudha. That triggers a number of questions that I'm going to direct to Tom Reardon. So Sudha made the point that at least in South Asia, it appears that some of the consultations the government undertook maybe benefited some players in the value chain. Others. Do you think that is an experience that was seen in other regions as well, Tom? And then Cecilia Gonzalez is asking, regarding some of the research gaps and who the policies benefit, what do you think is IFPRI's role benefit, in particular, small and medium enterprises, which do make up such a huge part of the, provide such a huge part of food supply around the world?
Can I start?
Yeah.
Yes, this is really good questions. I won't speak so much to who was consulted as to who was understood. And when you think about basic facts, like 80% of food consumption in these regions is purchased. So the extreme importance of keeping the food supply chains moving. When you think about the fact that 80% in South Asia and Africa of those food supply chains are small and medium enterprises, then the importance of keeping them functioning is important. And going into COVID, what we observed is that a lot of governments had the view that there was a missing middle, that the small enterprises were stuck in the mud, were traditional, were stagnant. And actually they had been dynamic, they were moving, they were getting ready to be resilient. And so when governments came to the table with COVID shock, sometimes it wasn't necessarily who were they listening to, but who did they think should have a voice or was acting, was a major actor. And so I'm thinking of the Nigeria case with the work with Sowita Liverpool-Tasia that we cite in the book. The Nigerian government had declared as non-essential crucial transport logistic services. And partly that was because it wasn't well known in the policy debate that 75% of the maize in Nigeria goes by third-party logistic services. Who would have known that the truckers were the centerpiece? And so their movement was limited or stopped, and that crushed some of the supply chains, not because people were ready. Then in various places, South Africa, Nigeria, where the government realized, oh, this is actually very important, and they declared as essential those services, things started flowing very quickly again. So a crucial thing is this research that we do, this nerdy research of farm surveys and midstream, as James was saying, these surveys to understand what's going on seems beside the point. You say, why are you figuring out what's going on? very often it's because governments have a view that's 20, 30 years out of date. And they're acting on that and doing the wrong policy things when push comes to shove. Getting that information about what's the reality right now really is crucial to be able to orient the policy debate. This is what James Thurlow had said about, we're often missing stuff in understanding what the food systems are doing. Reinvesting in that kind of research to understand that basic stuff allows the policymakers to respond well in crises. Thank you.
Okay, thanks very much, Tom. Nea, let me address one of the two questions that Chris posed to you. So he was asking about what else needs to be done in order to address some of the difficulties at the household level, right? And he put a special spotlight here on some of the incredible fiscal expenses that we've seen in countries, so which limit moving forward what can be done. So would you like to take a stab at that question?
Sure, it's not an easy question to answer, but I'll try. So I'll take an example which is actually presented in the book, where in Bangladesh there's a food-friendly program which delivers rice rations to households. And so during the pandemic, what they did was they increased the allocation. So given that they did that, that means the physical means were there, right? But in the recent survey that colleagues at IFPRI did, we found that people didn't actually receive these extra rations. So so the political will was there, the resources were there, but still the rations didn't reach the people. And so it's important to make sure that the monitoring systems are in place, it's functioning properly, and there's some sort of a check which can happen as we are doing it, not 6 months down the line when a research firm decides, let's do a survey and see, did the ration make a difference or not? So I think that's an important thing to keep in mind as we go forward. Let's make sure that the monitoring systems are in place, so it can trigger something which says, well, we said we'll do this, but it didn't actually happen. What's going on? Let's look into that.
Thanks, Nea. James, a question from Yasmin Sadat is asking the concern for increased sustainability of the food supplies on the mind of many. Any lessons from your recent research on this topic? You spoke a lot, of course, on the impact on poverty, on diets. What about the sustainability question?
No, I think that's also it's a new topic that I think we need to pay a lot more attention to. And I think it speaks to some of these trade-offs between a more vibrant, fast-growing agri-food system and one that is more sustainable over time and has a smaller footprint on the environment. And I think that comes back to some extent, that bigger question that Chris asked us, which is, sort of what needs to be done now? What more needs to be done now to try and balance all of these different trade-offs? How have those trade-offs and priorities shifted? And I think, Chris raised this issue of having 90 million more poor people in the world as a result of COVID. And I think that's relative to a no COVID baseline and in my mind, we have lost a couple of years of growth, maybe 2 or even 3 going forward. We might not recover, and we may never be able to get time back again. And so we will continue to be above, poverty will always be higher than perhaps we would have been had we not lost 2 years of income growth globally. And so for me, I was thinking, along the same lines of what Tom was saying, we need more attention paid to markets. We need more access to finance and working capital for small and medium enterprises and so on. But I think the bigger picture, to come back to Chris's point, and this speaks to the environmental considerations as well, we need to go back to that hard work of encouraging governments to have the tools for governments and investors to have the tools to prioritize between different investment options and to have the capacity to implement the policy priorities that we think are or that they think are particularly important, that they discover through research important. And then to have, as Sutya was talking about, to be able to navigate the political economy of the food system. This is the long-term investment, the muscles that Tom was talking about that we need within policy processes in developing countries. And I think that's still the priority. That hasn't changed. We've lost time, but I'm not sure the fundamental priorities have shifted for the food system, although taking environmental considerations into account may sort of temper some of the sort of fast growth goals that we've had, or poverty-driven goals that we've had in the past. Thanks.
Thanks, James. Valeria, you raised some linkages between the COVID crisis with what is coming our way with potential or already sanctions that have been imposed and other trade matters. So there's a question here from an anonymous questioner who's wondering, going forward, what matters most, global food security or local food security? Do you think that these consecutive crises are going to shift us more towards a local food security emphasis?
Thank you, Charlotte, and thank you for the question, which is not an easy one either. And I think that it really links with the previous question to talk about the environmental part of it. So I always feel that what we really need to always keep in mind is that we need to talk about sustainability, and sustainability in the broader way. So all these questions that relate with, well, it will be global, it will be local, what do we do? We need to keep in mind that big objective when we think about these things. So when you were talking just about environmental sustainability, there are countries that have more natural resources and that they are more keen to be producing in a sustainable way of some kind of commodities, where other regions in the world have not. So trade plays a crucial role in really bringing that food to places. So when we're talking about food security, clearly some countries will also depend on imports just because their own capacities cannot really get you to do all the local production. But there are some other things that can be done locally that will help. So for example, I don't know, producing lettuce, many countries can produce lettuce, and maybe it is a better idea to have it locally. But if you're talking about, I don't know, bananas, for example, clearly that is not going to be something that every country will be able to produce locally as well. So I think that it's a complex answer, but again, if we're really going to think about what's the future, we always have to think the objective of sustainability. So when you're designing the policies, and again, export restrictions, import tariffs, or all those things that countries do, obviously, if we will have a free world, which things will move freely, we will be more efficient thinking it in a global way. So I think that's going to be the answer for that. Thank you.
Thanks, Valeria. Jemima, there's a question from Nigeria from Professor Olufumi Olatoye, and it's a rather specific question about a particular value chain, poultry in Nigeria, where the pandemic, as well as other challenges, have disrupted the production and supply chain. And how can those losses be redeemed? Now, you may not be familiar with the poultry supply chain in Nigeria, but maybe you could speak more generally about supply chains in Africa in answering that question. How do we redeem losses that have occurred from some of the interruptions and disruptions?
Thanks very much, Charlotte. And yeah, it's not just the poultry value chains, but other value chains as well, and especially those value chains that were dependent on global export markets. So some of the early closures did affect movement of goods and services, especially across borders. But we're also starting to see some recovery in some of those value chains as some of the closures then got relaxed. But as James says, I think it's going to take time to see full recovery. What we saw in Africa is initially, a lot of the countries, including agriculture and the movement of inputs and input supplies as essential commodities that were not under restrictions. So we did see, much less disruptions than would have actually happened if there was a blanket restriction on agricultural supplies. But it's going to take some time for some of that production to stabilize. Some value chains also are very dependent on what Tom is calling the small and medium enterprises that had losses of income, that are struggling to rebuild, that weren't always reached by a lot of the government economic stimulus packages. So we are seeing a slow recovery, but I guess it's also a steady one as some of those restrictions lift.
Thanks, Jemima. I'm happy to say that Tom Reardon has worked on the poultry supply chain in Nigeria. So over to you, Tom.
Thank you. I want to echo some of what Dr. Njuki said. And I've worked with Sawida Liverpool-Tassier on this, on the poultry supply chain in Nigeria. And one thing that was so striking is that before COVID, there was tremendous dynamism of the local supply chain. Many women, for example, in northern Nigeria, got involved in producing chicken, selling to the local cities and towns. And wholesale markets, road access was crucial to that. And many of the chicken producers are using feed. Even small enterprises are using feed and buying feed. And again, that's going to be very dependent on the flow of the feed and the maize for the feed through these long supply chains that are dependent again on third-party logistics and wholesale markets. And that's one thing I wanted to echo from what James said, that and what this Sudha's point was fantastic about India. She said, well, there was in South Asia in general, there was a new policy on this, a new policy on this, a new policy on another thing, and then a promise about wholesale markets and road infrastructure. The promise was the one that's been left dangling, and the policies have been rolled out. And so in some way, I've seen this also in Africa, that the discussion about the centrality of roads and the centrality of wholesale markets went sleepy time for several decades. I found in so many governments that people said, what are you talking about wholesale market policy? What are you talking about this investment? They fell between the cracks. It wasn't national policy. The municipalities haven't already invested, but they weren't coming back to it. And so now the centrality of the blood and bones of the food system, the roads, the wholesale markets has to come up central, and that'll allow flexibility and capacity and the foundation for many of these other responses that we're looking for and many other complementary policies to be successful and sustainable. Thank you.
Great. Thank you very much, Tom. Let me ask whether any of you would like to make any additional points in response to the question that Chris asked about how do we make sure that we move into future crises or the new existing crises, safeguarding resilience. Anybody would like to take a stab at that? Valeria has already spoken about sort of some of the trade measures that ideally we should avoid. John, I see your hand going up.
Yeah, I think because of the complexity, I think we need to take a bit more systematic approach to resilience. I think Chris, the two issues that Chris raised are both interlinked. And I was going to take the perspective more about the first one, which was the household well-being, because I think there's kind of two things exposed. So one is, I made a point earlier about the basic needs. I mean, people need food, they need water, they need healthcare, they need income, and we need poor people need organizations that can help them navigate things to help empower women. There's all kinds of things we understand. So that kind of more systematic approach is useful, and sometimes it has to be community-led or more territorial or things like that. So I think that's one approach. The other thing on resilience is, as Tom pointed out, especially for low and middle income countries that we're focusing on, that we talk about informal markets and all these things, but they're really markets. And it's hard sometimes to decide what's informal and what isn't informal and stuff like that. But we really need to look at the context of the marketing, the food safety, the infection risks, and then how they relate to people's livelihoods. And often you see in these pandemics very draconian responses to, and proposals for kind of completely banning wildlife in quite poor areas of Africa, for example, wildlife. And those things just aren't going to work unless you're engaging communities and kind of adjusting the situation and moving forward. So I think these agency issues and the institutional issues need to be combined with some of the other things, and that it's worked for a lot of, on the health side, on the food side, on other things, and that's what I wanted to say.
Great, thanks very much, John. Let me now wrap up the Q&A session, and we're going to hear some closing remarks from Yo Swinnen again. And Yo, I think you probably will also maybe reply to Chris's very good question about future shocks.
Yes, thanks, Charlotte, and thanks to everybody here on the panel today. I mean, this was an extremely rich discussion, because also it's a rich source of material that is in the book and that has been presented. I think the presentations were excellent in a very short amount of time, pointing out some key issues. I think the whole issue, also the questions on, okay, what did we get right, what did we get wrong, and why did we get it wrong, and sometimes why did we get it right, is extremely important for us to go forward. Let me start maybe on the resilience issue that Chris brought up and where John responded to already. I think when we think about resilience, what we've learned, we have to think about resilience in dealing with resilience in a number of groups of actions, if you want, okay? So the one is prevention of, trying to prevent the shock from occurring. Okay, now that sounds like a bit of a weird thing to say, but for example, climate change, we know, right? We can do things. There is the risk of whatever is caused by climate change, and so we can try to prevent this as much as possible by mitigation actions right now, and you can extend that to a number of shocks, I think. So that's the first group of things one needs to do. The second one is information. If people are better prepared about what is coming, more precisely informed, etc., then they can anticipate, okay, the shock that is coming, and that makes the impact of the shocks hopefully less. And the third one is prepare them that if the shocks hit them, they are already there. For example, insurance is a crucial element there, finance plays an important role, and a number of other policy as well. Okay, so we have to see this as a set of action that need to be implemented at different levels. Let me then go back on a number of reflections of what we heard today. I think one of the things which we saw from the very beginning and which has persisted throughout the past 2 years is the uneven impact of COVID-19 across social groups, across societies, across the world, really. Some people have actually done quite well under COVID-19. Others have suffered tremendously. And we've seen, if you look at the inequality across the world, but also within smaller communities, the impact is really very different. The second one, my second point is picking up what John has emphasized in his slides and a summary and in our discussions. It's about smarter policies, okay? And that, I think it's a really nice way of framing these things. What have we learned? What can we do better? But it's also a very complex issue, of course. I mean, he emphasized that we need to take a food systems perspective, that is crucial. But that also means, and I think that's absolutely right, I mean, I've made the same point as well over the past 2 years, but the point also means there's a lot of interaction between these policies that are going on. For example, the health policies, for example, the lockdown, which are then affecting our economy, etc. So it's a complicated business to be in, and that also means that our analytical frameworks need to adjust, need to become more complex to deal with these things. So a lot of work for us going forward, I think. In the point I've written down here, which clearly relates to the resilience question there, food safety programs. I mean, that's something which has come out to a lot of our research by various groups of research and analysts as well. They have played a really important role in preventing some of the worst effects. And also they're crucial, I think, in being implemented, expanded, being improved going forward to deal with future shocks. Fourth point I have here is on the financial side. I mean, finance comes up regularly. It comes up at the macro level, it comes up at the micro level. It's something which everybody seems to agree this is important, but I think we can do better on that. We can do better work on how does finance work, the role it plays, and how we can mobilize new financial resources or financial resources differently in doing better work on repurposing. Subsidies fits in there, but it's much broader than that. And sort of the finance for food system transformation discussions, there's a lot of work to be done, I think. This also links to a point which was made both by Jemima and Sudha on the attention to the health system infrastructure. Both have said that we hope that this, or we are disappointed in the case, I think that Sudha said, that the attention there has not stayed beyond the initial effects, and that attention has now shifted to different government priorities. But this is crucial as investment areas for the future. A point which has come back through the whole set of presentation, I think, is our underestimation ex ante of the responsiveness both of the public and the private sector during COVID-19. I think that's a really important lesson for us to go forward. I mean, Tom has made this point very early on, but also on the government side. It's not only on the private side, but also on the government side, the rapid response in some areas. And again, governments could have done better, but at the same time, I mean, they have been remarkably responsive in a number of ways as well. I really like James's presentation of what we got right and what we got wrong on the modeling side. There is more of that if you look at the chapter by Rob Voss and David Laborde, and Will Martin has a similar discussion of that on the global modeling aspects. The regional differences, the differences in regional impacts, I mean, Jemima explains for Africa, Latin America, Valeria, who came afterwards. I mean, it's strikingly different effects in those things. That's really important for us to take forward as well and to understand and therefore draw policy implications. And then on this, the role of agriculture. Okay, this is something which several of people have made. I remember very much that early on, I had a blog where I was arguing that COVID-19 was having very unequal effect, and it was the poor who were suffering most. And that James commented, and he said, well, you have to be careful, okay, what you say with the poor, because if you look at across the value chain from the urban poor as consumers to the rural poor, most of them are farmers, the effects are very different. And so it's a bit more qualified than the general point. And I think it's been clear. I mean, a lot of the data that has come out has confirmed that early analysis that James and Steve have brought forward. So important there as well. And the issue of seeing agriculture as a social safety net from that perspective as well. The political economy, I think, clearly is playing an important role in various ways. The role that COVID-19 is playing in shifting our thinking, shifting the global policy debate has been crucial, I think. On the other hand, and this goes back to a point that Jemima made, I think as well, will it last? Okay, it's still there in the dark, but will it actually have an impact on action in the long and medium run? I'm going to end by 2 points. One is on our own, the implications for our own work. I haven't heard anybody say your work is done. It's mostly about, well, we need better data, we need more information, we need better models, and we need to integrate health perspectives, resilience perspectives, etc. So I think there's a lot of work for us to do go forward. I do want to recommend though everybody on the call here, on the meeting, to do look at the book, okay, because there's a lot of things in the book which has not been presented yet, so a lot more information there. And let me end just by a big word of thanks for everybody who's contributed in terms of analysis, in terms of their writing, and also certainly our CPA team in terms of putting this together, the event together, the many events we've organized, but also the book, and particularly Pamela and our team have done a heroic job in basically getting even the very last minute submissions into a beautiful publication as we have it today. And my final word is, again, thanks to John. You are our famous, our favorite epidemiologist. And after 2 years, I think I can pronounce the word properly now. So with that, back to you, Charlotte.
Thank you so much, Yo. Thank you to all the speakers and to all the authors of the different chapters of this book for the very important information you provide. Also terrific that the COVID-19 hub of the CGIAR has, in addition to putting out these research findings, has really engaged with countries and has been responsive to the needs of the countries. So really important work being done to support policy decisions. We would love to see many of you back at the same time as we started today's seminar on Wednesday. We are having an event on global commodity prices and food security, navigating new challenges and learning from the past. This is the first IFPRI policy seminar in a series on food and fertilizer price trends, impacts on global food security. As many of you know, of course, and we've discussed it today, food prices have already been rising throughout 2021, and recent developments in Ukraine are only going to impact that further. So please do join us on Wednesday. Many thanks again to all of you and to our audience for your active participation, all your questions, and many thanks also to the CPA team for putting on this event. Have a great rest of your day or evening, wherever you may be.